Hello, welcome once again to your family chat with your pharmacist, Chiedu. We're going to be discussing something very important today. Something that affects practically everyone. Yes, because at a point in time, everyone has to take some medications. We'll be talking about medication mistakes we make every day. This is important because sometimes it leads to very huge problems. It can lead to treatment failure, wastage of money, and in some extreme cases, it can lead to death. I want you to sit back, relax, watch, and learn. You see your medications. Sometimes the way we take them is the reason why we don't get results. For instance, I know that it can be very overwhelming taking drugs. I have the experience. Especially when you have to take them several times in a day, you have to take it 3 times, 4 times, or you have to take it for a very long time. For instance, you're being managed for hypertension, you're being managed for diabetes, and things like that. So sometimes we tend to forget to take our medications. Skipping your medications can be a huge problem. It can lead to resistance for antibiotics. It can lead to fluctuation in your body levels of sugar, BP, and those fluctuations are not good for your body. Another one is stopping your antibiotics before time. So sometimes they prescribe antibiotics for 3 days, 5 days, 7 days, and even more. But along the line, we begin to feel better. The symptoms begin to reduce, and we feel that, we're better, so we can stop it. No, you cannot stop your medications. There's a reason the doctor has said you should take it for a particular number of days. When you don't complete your doses of medication, you see those microorganisms, they will be waiting for you, jeje. Immediately you stop your medications, they will bounce back. And sometimes when they do, they become more fierce. They become resistant. You now have to start looking for other antibiotics that may be more expensive, that may even not be available, and all that. So it is important you take your drugs for as long as they were prescribed. Another one is taking drugs with alcohol and some herbal teas, even your juice. You know that alcohol and herbal teas, they act the same way that medications act in the body. They alter the physiology of your body. So sometimes those herbal teas you're taking can reduce your blood sugar, can reduce your blood pressure. And if you are taking them with your prescribed medications, it can drop the levels to very low levels that can become a big problem. It can lead to emergencies. Your alcohol, when you take them with certain drugs like paracetamol, can damage the liver. So be careful how you take these things with your medications. So maybe you've gone to the hospital, you were experiencing certain symptoms, and the doctor prescribes medications for you. Some other time, you feel the same way, you immediately go and dig up your old prescriptions and go and get the medications. No, you don't do that. Several illnesses can come with the same symptoms. Not every body ache is caused by malaria. Not every headache is caused by malaria. So sometimes these symptoms may look alike, but the diseases are different. That is why you have to get to the hospital, let the doctor check you, and then prescribe drugs for you. Never use old prescriptions for new illnesses. Another important one is ignoring food instructions. So the pharmacist tells you, you have to take this medication maybe first thing in the morning, and you have to wait for at least 2 or 3 hours before you take your next meal. Or they tell you take it 30 minutes before meal. It is important to adhere to those instructions because sometimes the way your body reacts to your drugs depends on the environment of your stomach. So if you don't take them according to the way you are instructed, you will be wasting your time. Your medications will not work and you will not get better. If you look at each medication, there is usually a storage instruction. Sometimes you are told to store in the refrigerator. Most times you are told to store in a cool, dry place. Please, it is important to adhere to those instructions. Each drug has an expiry date, which is determined by how long the medication can stay without reducing its potency to a certain level. If you store your medications in a hot place, for instance in your car, or in a place that is always wet, like in the bathroom, you're going to increase the rate at which the drug reduces its potency. So you'll be looking at a drug that's supposed to expire in 2026. Meanwhile, the expiry has reduced to something much less than that. So please adhere to your storage instructions. Another very important one is sharing medications. You have a friend or a family member that comes to you, oh, I don't know, I've forgotten to take my drugs today, and I'm on antihypertensives, and you decide to give them your own. Don't worry, you can take this one for as long as you are staying. When you get back home, you continue with your own. You can't do that. The best thing you can do for that your friend is to walk into a pharmacy and get the proper medication, because every medication is prescribed according to patient's history. That's why when you get to the hospital, the doctor wants to know, do you have any chronic diseases? Do you have any allergies? They will run some tests before they prescribe drugs for you. So it is important you use your drugs only for yourself. Never share your medications with anybody. So thank you for watching. If you found this piece very educative, please click on the like button, follow me, share so that other people will learn from it. Bye for now. This is your pharma coach, Chiedu.